functional screen, we have tucking our chin to our chest, so cervical flexion, cervical extension, and cervical rotation. You may also want to add in shoulder motion here, because oftentimes when individuals lack coordination in their shoulder and they raise their arm up, they tend to elevate the shoulder complex using upper trap to assist, and that's actually reverse side bending of your neck. So they might be doing constant cervical side bending with that movement. So doing a quick screen of shoulder movement and looking at how scapula move with shoulder movement is very helpful. Okay, so palpation, we've got lots and lots of muscles to palpate. Trapezius, SCM, your suboccipital muscles, scalenes. You can definitely palpate the spinous processes, and we'll talk about facet joints for mobility testing, but just come right off your spinous process before the transverse process, and you'll be on the facet joint. So lots of things to palpate here. Can't really get into these deep cervical flexors, but should definitely be able to grab the more superficial musculature. Okay, so range of motion. Again, just be aware that we're looking at right to left when we're looking at rotation, and active compared to passive range of motion, not just quantity of motion, but quality of motion and symptoms with motion. You probably do not need to add overpressure for infills in the cervical spine. In most cases, it's not necessary, and individuals with neck pain do tend to be very sensitive, and you may not want to add that overpressure. The weight of the head is typically enough. But again, we want to look at flexion, extension, rotation. We can look at the side bending component. And then we've got quadrants, our combined motions. So opening the foramina all the way and closing the foramina all the way. So we can open the foramina all the way by combining flexion and side bending and rotation to the same side. We can close the foramina all the way by doing extension, side bending, and rotation towards the same side.